Hello everyone. So today marks World Diabetes Day, and WHO has coined the theme for this year as Breaking the Barriers, Bridging the Gaps. It's all about ensuring that the risk of having diabetes, especially type 2 diabetes, is curtailed, and that people who already are diagnosed with diabetes receive comprehensive, affordable, quality health care. So let us spread the awareness of diabetes and ways to manage and prevent diabetes. So let's dive in to the topic of today. I'll be talking on diabetes, its definition, causes, risk factors, the types, signs and symptoms, complications, management and prevention. For the purpose of this topic, I'll be using diabetes because there's another type of diabetes called diabetes insipidus. But diabetes insipidus does not have any relation with diabetes mellitus. Diabetes mellitus affects blood sugar levels, but diabetes insipidus does not. It's a different one. So when I'm using diabetes, know that I meant diabetes mellitus. So what is diabetes? Diabetes is a chronic condition that causes high levels of blood sugar, and this is termed hyperglycemia. There are other types of diabetes mellitus. We have stage 1 or type 1 diabetes mellitus. Type 1 diabetes mellitus is also called insulin dependent and is also called juvenile or childhood onset. This one, by the name implies, you see that it occurs in children more. It starts children, especially because they have maybe a genetic factor or there's a family history already of diabetes as well. And it's called insulin dependent, meaning that their management is usually with insulin. While type 2 diabetes or the adult stage diabetes is usually treated with oral anti-diabetic medication. And so these ones are beginning in adult stage and is major, is the most incidence of diabetes, the most cases of diabetes is type 2 diabetes. Okay, what causes it? The pancreas is an organ in the digestive system. The pancreas produces insulin, and this insulin is necessary for conversion of glucose, which is the end product of carbohydrates. It's necessary to convert glucose into glycogen. That's what the work of insulin. But in type 1 diabetes, these people, usually their pancreas is destroyed, and so they produce no or very little insulin. And so they cannot metabolize our food. So that's why they are giving insulin to help them out. Why in type 2 diabetes? Usually these people, is either they don't produce enough of the insulin, or the body cannot use it effectively. There is insulin resistance. The body cannot utilize that insulin being produced, so there's insulin resistance. And so they are treated with oral anti-diabetic medications or tablets. Okay, there's another type of diabetes, gestational diabetes. As the word implies, gestational, it's pregnancy diabetes. So these people usually, their blood sugar level might not be as high as one that has type 2 diabetes, but occasionally they might go up having type 2 diabetes if not properly managed. Another one is pre-diabetes. As well, in pre-diabetes, their blood sugar level is high, but not as the level of having type 2 diabetes. And if not properly managed as well, they can go ahead to have type 2 diabetes. So what's the blood level of blood sugar, or what's normal blood sugar level? Because for you to know that your blood sugar is high, you need to check your blood sugar to know if you're becoming hyperglycemic, or the opposite, which is low, hypoglycemic. The normal blood sugar level before breakfast, pre-breakfast, is between 4 to 7 millimole per deciliter, which is about 50 to 70 if you're using the other range, milligram per deciliter. If you're using millimole per liter, it's 4 to 7 millimole per liter. But if it's in milligram, or if it's in gram per deciliter, then it's 50 to 70. That's before breakfast. If it's between 8.5 to 9 millimole per liter, it should be 2 hours after eating or after meal. Then it's a normal range. But anything above 9.0 millimole, that's hyperglycemia. Okay? And so, what are the risk factors as well? Risk factors of having diabetes is obese. When someone is obese, for you to get your body mass index, you need to get your body mass index to know whether you're obese or not. You need to check, your height and your weight as well. You can check on the website as well. NHS has a proper one where you check it and then you get your body mass index. It takes in combination also your raise and stuff like that, and you get it. Okay. You also need to check your waist. There's a waist height ratio to record as well. Another risk factor is hypertension. When you're hypertensive, there's a risk factor. There is tendency that you have diabetes mellitus as well. We also have poor diet intake. Yeah, when you take excessive sugary substances, you take fizzy drinks, you take the sodas, you take energy drinks, you take sweetness, all those chocolate and stuff, and sweets and stuff, sugary drinks and the rest. Is in tendency you can have high blood sugar as well. And also when you have a family history I mentioned before, there's tendency you can have high blood diabetes as well. Also, it's more common in Asian people, in Asians, Black Africans, or Black Caribbeans as well is more common in them. So what is the prevalence or incidence of diabetes mellitus? According to the statistics taken in 2021 by International Diabetic Federation, about 537 million people were diagnosed and living with diabetes mellitus. That was in 2021. And among these 537 million, 67 million among those 6.7 million have death-related diabetes mellitus. Coming in UK, we have, according to the statistics taken in 2022 to 2023, about 5.6 million people are living with diabetes mellitus. So it's become more imperative that we watch what we eat. We check our health status to know if we are diabetic, pre-diabetic, or not diabetic. So what are the symptoms, signs and symptoms of diabetes? We have the three main B's: polyuria, polyphagia, polydipsia. Polyuria is when someone pees a lot, especially during the night, can stop their sleeping pattern. Polyphagia is excessive hunger leading to excessive eating. Person start eating a lot. Polydipsia is excessive thirst. Because this person is peeing a lot, he's become thirsty and is drinking. When he's becoming peeing a lot, he might start having dry mouth, which could make him to drink more. So there's polyuria, polyphagia, and polydipsia. Other signs could be feeling weak, fatigue, feeling so tired. It could also be unintentional weight loss. This person start losing massive muscles, start losing weight. It's unintentional. It can also cause infections, itching around the vagina area, cause infections like thrush. It can also cause bladder infections like cystitis. For the thrush, it's because this blood sugar level is high, hyperglycemic, and candida, which is organism that causes thrush, has affinity for sugar, and so it can cause thrush when the blood sugar level is high. Okay, so these are signs and symptoms you can see when someone is having diabetes. All right, why? Mainly it's more on when the person is having hyperglycemia, high blood sugar. But when that blood sugar drops, it could be that the person has taken excessive insulin, excessive oral medication, oral diabetes tablets, or the person is not eating and is taking insulin, not eating at all, eating too little. That can bring the blood sugar low, and the person goes into hypoglycemia or hypoglycemic shock, and that is a medical emergency. When that person goes into medical, becomes hypoglycemic, the blood sugar level is below 4.0 millimole per liter. The person can start presenting with signs of shock. It's having a rapid pulse rate. Could start with rapid respiration and then start slowing down to shallow respiration. The person starts sweating profusely, start having becoming cold and clammy. The person is palpitation. The person is just losing unconsciousness, and these are signs that you see in a person with shock. But what are the ways you manage it then? If you see someone that has high blood sugar level and the person is alert, quite alert and conscious, you can give that person water to drink. Water will help to dilute it. Also, you can ask the person to engage in exercise. It will help out. And don't forget, you can ring for ambulance, or you can take the person to the hospital, to the surgery, or ring for surgery. If the person is still quite conscious and alert, you can go to the hospital or go to the clinic. But if the person is hypoglycemic, that on the person, if the person is still alert when the blood sugar has dropped, you can give that person 5 grams of glucose tablet, or there's this glucogel that's usually prescribed they are giving. You can give that person that glucogel, or you can give that person simple carbohydrates, like fruit juices as well. But when you're giving the person, you need to also be checking the blood sugar level. Why at the same time you're ringing for emergency, ringing the ambulance, ensure that person is properly taken care of. You have to take the person to the hospital. But if this person is not conscious at all, please, it's a medical emergency. Take this person to the hospital immediately. Call the ambulance immediately. Okay? So we've talked about management of hyper and hypoglycemia. So what are the complications of hyperglycemia or diabetes? Complications that could result is, we mentioned about hyperglycemia is another complication. In hyperglycemia, if this blood sugar is too high, it can cause what is called DKA, which is diabetic ketoacidosis. In diabetic ketoacidosis, you see this person having this acetone food-like smell from their breath. They're gonna start having rapid breathing, what is called Kussmaul's respiration. The person is, irritable, it may be having abdominal pain, discomfort, they might start vomiting. These are signs to show that this person is having diabetic ketoacidosis. It is a medical emergency. And as well, on the other side, and it's more common, diabetic ketoacidosis is more common with people with insulin or type 1 diabetes. Another complication could be hyperosmolar hyperglycemic states. It also occurs more with people with type 2 diabetes. In this case, this person is having severe dehydration because this person has lost fluid. He has peed a lot, so he has lost fluid, he's having dehydration, and with the signs and symptoms. So this person is trying to get rid of excess sugar and is becoming dehydrated. Okay, so another complication could be renal failure, kidney issues. It could also be heart failure, cardiovascular conditions as well. Other complications could be blindness, eye issues, diabetic retinopathy. Yes, diabetes can cause diabetic retinopathy. It can also be peripheral neuropathy. Diabetes affects the nerves. And so when these people, because the nerves have been damaged, they will not have any feeling, any sensation. If they have any cut, any bruise, any ulcer, they might not even notice it on time until that ulcer has become so, has worsened before they start noticing it, before they start seeking for help. So these are the signs, these are the complications of one having diabetes. So then, how do we prevent it? Diabetes. We've talked about the causes and the risk factors. So we need to watch what we eat, and then lifestyle is so important. Watch our diets. Ensure we're not eating high glycemic index food. We need to look at the contents. If you're eating all this processed packaged food, we need to check the calorie intake. As you're checking it, be aware of if you're diabetic or not. If you're diabetic, ensure that you check your blood sugar, because sometimes when you go on the very low calorie diet, you might also cause yourself hypoglycemia as well. So balance it with your blood sugar and ensure that you seek your doctor's advice or the diabetic nurses as well advice as well. So, but for those who don't have diabetes, ensure that you watch what you eat. Don't eat highly processed food. Don't eat sugary, you know, secondary sugars. Don't eat sugary intake. Limit it. Don't eat all this soda, fizzy drinks, and energy drink, sweetened drinks. Limit it or even stop it entirely. Eat your normal, natural diet. Ensure they are low calorie or low glycemic index. And lifestyle. Ensure you exercise properly. Exercise regularly. Could be the aerobic or the anaerobic exercises. Ensure you engage in both of them. Then if you're smoking, quit smoking. If you want to take excessive alcohol, stop it. These are ways we can manage. And another thing, if you're obese, ensure you reduce your weight, work on your weight. And by so doing, we will be able to prevent the risk of having diabetes. Thank you.